My name is Edward Huacha. I'm the general manager of Umunthu FM, one of the local radio stations based in Korakora district in Malawi. Umunthu FM is one of the 2022 recipient of the grant from SRHR International. We implemented a 9-month project, and the title of our project was Documentation of Menstrual Health Hygiene for People with Disability. In that particular project, our key knowledge product which we produced is a booklet, a one-page booklet in English as well as in Chichewa, and that particular one-page documentation translated into 4 if not 5-page document in Braille. So this publication was a compilation of key laws and policies that protect and promote access to menstrual health management, particularly to girls and having with disability here in Malawi. It has been developed from the background of continue having limited access to information on regular framework that protect and promote menstrual health management by girls and women with disabilities. We have noticed that girls with disabilities, particularly those who are blind, they tend to have some difficulties to access the sexual reproductive health policies. So as such, their rights tend to be violated because they don't have access to information. Even though we have a very good legal framework, but because majority of women, particularly those who are physically challenged, who are blind, they don't know how to read. I mean, they don't know how to read the normal write-up which are done in English or in Chichewa. They tend to have some challenges. So through this project, we translated or singled out the policies, particularly 3 major policies that are within the sexual reproductive health policies. So we identified the key 3 major policies, particularly Person with Disability Act, Protection and Justice Act, and the Sexual Reproductive Health Policy of 2017 and 2022. So we focused on these policies. We translated from English into Chichewa, then also turn it from Chichewa into Braille. Then we distributed to a number of girls, about 300 girls and women who are visually impaired. They actually get access to these policies. And these girls and women, they tend actually to give a testimony that Umunthu FM has helped them to know their right, particularly on sexual reproductive welfare rights, just because they're able now to understand what does it entails when we're talking about sexual reproductive health, particularly those who are maybe experiencing menstrual hygiene, well, on menstrual period. Yeah, so as the Umunthu FM, we're so thankful with the support which we receive from SRHR International, because research has also shown that within the region where we are based, where we are executing our task, we seem to be the first organization who has translated the knowledge product from English to Braille. In most cases, people don't actually maybe to translate it from English to our local language here in Malawi, which we call Chichewa. But if in our case, we went actually further to the extent of translating it into Braille. And despite the fact that the process of translating it into Braille is so expensive, because the expertise as well is also very limited. The machine that tend to replicate the publication from other languages to Braille are also very scarce. So with also the limited resources, because the project was a small grant, but still more, we tried the level base to make sure that we achieve that particular goal. Yeah, so we are very thankful, and we appreciate as well for the support which we received from China International, particularly Madame Kimberly. She was the one who was also providing us the guidance on how best to can implement the project which we implemented last year. Thank you so much for listening. Thanks.